Secure 65 health plans where seniors thrive.
Major hospitals are cutting Medicare Advantage. Watch now, here at Secure 65 Health Plans.
Worried that your doctor is gone from your network? Watch now at Secure 65 Health Plans.
Your coverage could change, and your medications might not be covered. Watch now at Secure 65 Health Plans.
Secure 65 health plans where senior thrive.
Austin's cartoon makes my grandpa happy. Thanks, Austin.
Austin's cartoons made my day. Thank you for making me laugh, Austin.
Meet our new resident joy maker and cartoonist, Austin Bloxon. He's here to put a grin on your face and warmth in your heart. So the news, the numbers, and the changes are much easier to swallow. Welcome to the team, Austin. Bring on the laughter.
Secure 65 health plans where seniors thrive. Secure 65 health plans where seniors thrive. Secure 65 health plans where seniors thrive.
Hey seniors, what's going on? It's Moné Swann here, your senior advocate and friendly neighborhood truth teller. This is Secure 65 Health Plans for those who are new to our channel. This is where we come to do things. We don't panic, we plan. Now, before we jump in, do 3 quick things for your future self. Subscribe, tap the notification bell, and share this with anyone on Medicare. Now, the headlines are loud, the letters are confusing, and today I'm going to make it simple. That's the way we do it around here. Now, if you're already stressed, or you're, you just want a pro to check out your situation, don't hesitate to call us at 833-300-4968 or email us at info@secure65healthplans.com for your free one-on-one consultation. We don't charge for anything here. We believe you deserve the best free of charge, and we are here to give it to you. Now, one of the perks that each and every one of you get is your own personal senior advocate's cell number and email. You know, as in a real human who answers real questions. That's how we do it here, family. You're never alone. All right. Now, let's talk about what's happening and why you're hearing that Medicare Advantage or MA plans are in trouble, and what you can do today to protect your care, your doctors, and of course, number 1, your peace of mind. Segment 1, what's actually going on in plain English? Ready? Okay. So what's happening, you guys, is we're seeing a shift. More hospitals and health systems are reevaluating or even dropping certain Medicare Advantage contracts. Translation? Well, your favorite clinic or specialist might not take your MA plan next year, even if they did last year. Why? Well, pretty easy to understand, right? Costs everywhere are going up. Staff, meds, equipment, compliance, everything. And then there's administrative friction between some providers and some MA plans because of slower pay, tighter rules, and more back and forth that nobody wants. Next, well, there's network changes and market exits. Some insurers are pulling plans from certain zip codes altogether. Now, I want you to understand this is not about you guys doing anything wrong. The system is simply shifting. When systems shift, we pivot to the next best thing. And we don't wait and hope. Not here at Secure 65 Health Plans. Segment 2, why this should matter to you right now. So you guys, if your hospital system or specialist leaves your MA network, well, you know what you could face, right? Surprise out-of-network bills or no access to that provider. Now, there's also changes in medication coverage under the drug portion of your plan. And let's not forget those confusing letters and tight deadlines that sneak up during the holidays. Yeah, who thought that was a good idea? Really? During the holidays? Yeah. So come on, guys. We got to do better. There's nothing festive about reading your Medicare booklets during the holidays and times that you'd rather spend with your children, your grandchildren, and your friends. So let's face it, you deserve continuity, the same doctors, the same meds that you need, and a plan that fits your life. That takes action, not guessing. Segment 3, what to watch for today. I'm your coach. Okay, so we are going to talk about number 1, your annual notice of change, also known as your ANOC. Read it, you guys. Circle changes to copays, deductibles, and networks. In Part D meds, it's important. Number 2, your doctors and hospital check. Call your providers. Will you take my exact plan next year? Or call us. We already know, and for the most part, which plans are leaving and which ones aren't so that we can help you. Number 3, medication check. Make sure your drugs are still on the formulary at your preferred pharmacies. Why? Well, to save you money and the peace of mind that everything is not only going to be covered, but going to be covered for less. And number 4, the timeline check. I know, you guys, I don't like it either. My family knows that I work during the holidays. It's important to me that you get the right information, the right coverage, and you are treated like the kings and queens that we know you are without waiting on the phone forever or being pushed to make a decision when you're not ready, or even worse, talking to someone who doesn't really care if you get what's best for you or not. So remember these dates. AEP, annual enrollment period, is October 15th through December 7th. Make moves now so you can get what you're looking for starting January 1st. Waiting until January can create a coverage gap. Our schedules are filling up fast, so call us today at 833-300-4968. A lot of you see the value that we are able to give you. Now, if reading this stuff makes your eyes cross, we'll do it for you. That's what we're here for. We want to get you squared away so that you can return to your sweet potato pie, turkey, and stuffing, and of course, your family. That's what holidays are for. Wouldn't you agree? Segment 4, let's be real. This is bigger than one plan. You guys, healthcare is consolidating. Big systems are buying smaller ones. And when that happens, those systems get more power over which plans they'll accept. That means networks matter even more. Choosing the right plan for your doctors and your meds is not optional now. It's everything. So listen, you guys, I'm not here to scare you. That is not my intent. I am here to wake you up, though, because when you're proactive, you keep control, and that means you get the things you want. And with us, we'll make sure you get them. Now, we're going to go into the list of names you guys asked for to see what carriers and plans will be affected for 2026. Now, I split them into two parts. The first one are insurers, known as the Medicare Advantage companies, who are pulling back or exiting the market completely. And number two are hospitals and health system. Those are the providers, okay? And they're dropping some or all MA contracts. Now, I'm citing each source so you can see where we got the information. It's on the screen, and it will also be in the description box below. So number one, Medicare Advantage insurers pulling back or exiting. Number one, United Healthcare, also known as UHC or United Health Group, exiting 109 counties, primarily the PPO plans by 2026. Thousands of you guys will be affected. Aetna, also CVS Health, scaling back footprint in 2026. There'll be fewer counties and states than 2025. Vermont Blue Advantage, Blue Cross Blue Shield of Vermont affiliate, ending all MA plans in Vermont at year end. So now we're going to jump into part two, hospitals and health systems dropping MA contracts. Okay, you guys, this is Becker's list for 2025. These are the 31 systems. Mass General Brigham in Massachusetts. Most of the primary cares will no longer be in network for UHC for their MA plans or for BCBS, which is Blue Shield in Massachusetts. Kettering Health in Ohio will no longer contract with Humana and Devoted Health past 2025. Next is Memorial Healthcare System out of Florida, out of network with Florida Blues for their MA plan starting in September. Next is Iowa Specialty Hospitals and Clinics in Iowa, dropping all MA in 2026, except Aetna, Medigold, UHC, Wellmark, BCBS, that's Blue Cross Blue Shield. Okay, so know that if you're in Iowa. Johns Hopkins Medicine, Maryland, out of network with UHC MA plans in August. MUSC Health in South Carolina, contract with Humana MA expired June 30th, so that you know. Brown University Health in Rhode Island, mutually out with UHC, so United Healthcare MA plans. Next is North Mississippi Health Services, out with UHC. It's out with UHC's MA plan starting in June. Okay, so you guys have that. Salem Health in Oregon, out with Regence Blue Cross Blue Shield MA plans in February. Bay Health terminated Humana and Cigna MA plans January 1st. So for those of you who have that, you probably will get a way to get back into a guaranteed issue. Now, Baylor, Scott, and White out of Texas, out of Humana's MA plans. Trinity Health Michigan, out of Humana's MA plans. Mercy One out of Iowa, out of Humana MA plans. Now in North Carolina, Wake Med is out of Humana MA for non-state retirees January 1st. Next, Common Spirit Colorado is out with Humana starting January 1st. OSU Wexner Medical Center in Ohio is out with Anthem Medicare Advantage plans starting January 1st. WVU Medicine, Uniontown, Pennsylvania, out with Highmark in Pennsylvania. Whole Care MA plans starting January 1st. North Memorial Health in Minnesota ended Humana Medicare Advantage plans. Essentia Health in Minnesota is out with Humana Medicare Advantage Plan 2025. Prairie Lakes Healthcare System, South Dakota, dropped Humana Medicare Advantage plans starting in January. Vanderbilt Health in Tennessee out with Blue Cross and Blue Shield, Tennessee Medicare Advantage plans. Avera Health in South Dakota ended Humana Medicare Advantage plans January 1st. Blessings Health in Illinois in 2025 approached equals only Blue Cross Blue Shield, United Healthcare, and Molina, Total Retiree Advantage in Illinois. LMH Health in Kansas, no Aetna or Humana Medicare Advantage plans January 1st. Stanford Health, Minnesota, dropped Humana Medicare Advantage in Minnesota in 2025. Great Plains Health in Nebraska accepts no Medicare Advantage plans in 2025. Kimball Health Services in Nebraska accepts no MA plans in 2025. Carson Tahoe Health in Nevada stopped most MA plans, kept Prominence and Renown Senior Care Plus. Southwestern Health Resources in Texas. Well, their Health and UT Southwestern are out with Aetna Medicare Advantage plans in 2025. Alena Health in Minnesota is out with Humana Medicare Advantage plans 2025. My Michigan Health is out of Aetna Medicare Advantage plans. Now, there are extra current examples like Door County Medical Center in Wisconsin being dropped from United Healthcare's Medicare Advantage in network starting January 2026. That's Door County Pulse. Now, you guys, you need to understand these lists will change and they could change fast. And the list will be in the description box below. Some are statewide, some are county specific, some are for one carrier only. But before you switch, let us check your doctors, your hospitals, and your prescriptions against next year's networks and formularies. Okay? Now, this is why I tell you guys, email us at info@secure65healthplans.com or call 833-300-4968 for a free same-day plan check. We'll verify your providers and meds and give you clear options so you're protected January 1st. Segment 5. What Secure 65 does for you and why people call us. Well, first and foremost, we read your letters with you. No jargon, just clarity. We map your doctors, your hospitals, your meds to the plans that actually work for your life. We show you 2 or 3 smart options, explain the trade-offs, and do the paperwork. We give you an advocate's cell phone, so when a letter hits your mailbox, well, you're never going to be alone. You'll know exactly what you have and how we can continue working with you for all of your needs. We stay with you not just during enrollment, but for as long as you need us. We are community, not a call center. What we do for you is based on relationship and not transaction. So again, if you are feeling stuck or just don't want to get stuck, I think that's important, call us at 833-300-4968 or email us at info@secure65healthplans.com right now. Tell us, I want a plan check. We'll review your ANOC, your meds, your doctors, and lay out your best next step today. And it's all free. No obligation, just protection. And you guys remember that old commercial, free. That's what we do. Well, we can't really say that too much because that's not from us. But we love you and we want to make sure you're taken care of because you deserve it during your golden years. Segment 6, Community Movement. Come to our Love and Trust Tour on October 18th at 10 a.m. Pacific Standard Time on Zoom. Can't get easier than that. It's where we talk like humans about health, money, and aging with dignity. No sales scripts, just solutions and a lot of love. It's sponsored by Walmart's Spark Good. When you attend, you receive a digital Medicare handbook, and if you attend in person to one of our seminars, you'll get a hard copy to keep and use it whenever you need it. But if you want to attend, you must call us now to RSVP. Scan the QR code on the screen or email us at info@secure65healthplans.com. Do it now so you don't forget. We can only make it available to a few hundred people based on our licensing agreement with Zoom. And I want you all to attend. So first come, first serve, and then we might do another one. Heck, you can invite some friends to your home or look at it on the big screen at church or a community center. You have options. So call us if you need some help or if you want us to give you a do-over in your city. We are in 44 states, so give us a call. We have speakers who are experts in health, supplemental, short and long-term care, and annuities. So this is not a sales presentation. It's just to let you know what's out there. This is the Love and Trust Tour, and you will even receive information on Social Security, and there will be a Q&A at the end so you can ask your questions. You can also make appointments with us. So make plans today to be with us on October 18th, 2025. I would love to see each and every one of you there. Now, again, to RSVP, you can call 833-300-4968 or email us at info@secure65healthplans or simply scan the QR code on the screen. Segment 7. Now, these are my final words on all of this, you guys. This is what you need to take away with you. Yes, Medicare Advantage is shifting. Yes, networks are moving. And yes, contracts are changing. But you are not powerless. With the right guide, you can keep your doctors, cover your meds, and protect your what? Peace of mind. So again, today, give us a call at 833-300-4968 or email us at info@secure65healthplans.com today for your free one-on-one consultation. We don't charge for anything. You'll get an advocate cell number because we don't disappear after December 7th. We are here for you all year round. And don't forget, you guys, to subscribe. We need you to subscribe, share, and tap the notification bell because the next episode might save your cousin from a very expensive surprise. Thank you for joining me today. I'm Moné Swann, your senior advocate and your believer in good health. Stay informed, stay encouraged, and as always, stay golden. Love you guys. Bye.
Secure 65 class plans. We're saying fly. Secure 65 health plans where seniors thrive. Secure 65 health plans where seniors thrive. Secure 65 health plans where senior thrive. Secure 65 health plans where seniors thrive. Secure 65 health plans where seniors thrive.
Vivex Wealth Insurance Solutions.